We've talked a lot about agents that typically kind of focus in more of the upper respiratory tract. Now we're going to go down a little bit lower and start talking about the bronchi and kind of the lower respiratory tract. So our first class of medications we're going to talk about is our short-acting beta-2 agonists. These typically are referred by patients as your reliever or sometimes rescue medications. According to the National Formulary of India, your salbutamol inhaler is one of the products that is a short-acting beta agonist that is available. When we look at the different products that are more available worldwide, other beta agonists that are beta-2 agonists that we see is Albuterol, which comes in multiple types of branded products, as well as levoalbuterol. Now, if you look at this particular type of medicine, what you're going to notice, if you remember back to some of your biochemistry, organic chemistry days, okay, this is just actually the active isomer of the racemic mixture of albuterol, okay? Now, is there any difference between the albuterol and the levoalbuterol? Manufacturers of the levoalbuterol would say that this formulation tends to have a little bit less side effect profile. However, in clinical practice, we don't see that primarily as much if they're using these products just as on an as-needed basis. Where there is a little more efficacy to support the levoalbuterol use, potentially maybe in more of that emergency or acute care setting where it's being administered by a health professional. So how do short-acting beta agonists work? So short-acting beta agonists are able to affect the lungs by attaching to and relaxing the smooth muscles that wrap around the bronchi, and they improve asthma control. So they attach and then they help to relax those muscles. Typical onset of short-acting is less than 10 minutes, and typical duration is going to be about 4 hours depending on how the patient metabolizes the medicine. The most clinically significant side effects associated with short-acting beta agonists, or sometimes people will refer to them as SABAs, is skeletal muscle tremor and tachycardia. So these are great medications to have for patients who have respiratory diseases such as asthma or COPD, and particularly in our asthma patients, they should always have a short-acting beta agonist available in case they get into trouble with an acute exacerbation of their asthma. However, we do not want them to be overutilizing these products, because what can happen is you can see a downregulation of that beta receptor in the lungs, and then this medication, when they really need it, will not be as effective. And so increased use of greater than 1 canister per month is an indicator of a patient's over-reliance on the short-acting medication and may increase the risk for life-threatening exacerbations, and this primarily is associated with asthma.